Take control of your back health. I'm Doc John from Mobility Doc, and today I want to help you to understand and manage your low back pain. We're going to link in our video showing you how you can begin today to decrease your low back pain as well as strengthen your low back. This video is for those of you who want to better understand what low back pain is and what you can do about it. Low back pain is widespread among today's adults. Over the age of 30, about 80% of us are going to experience low back pain at some point. There are some things you can control and there's some things you can't control, but the good news is if you watch to the end of this, a lot of it is well within your control. And right now what we're gonna tackle is, what are the two most common classifications of low back pain? Are there any genetic factors that predispose you to low back pain? And what are the environmental factors that you can control to not only get rid of your low back pain right now, but make sure it doesn't come back? First, let's go over the two categories of low back pain, being discogenic and non-discogenic. And for the purposes of this video and your low back pain, these are the two types of low back pain we're covering. Discogenic refers to low back pain that is caused from a disc herniation or protrusion. Non-discogenic refers to all of the other reasons why someone would have low back pain that's not related to the disc. That can include the joint, like the facet joints. It can include the sacroiliac joints. It can also include muscle and the connective tissue that would lead to low back pain. Now, while it's true that a significant percentage of adults, about 30% or more, have disc protrusions, it's also true that many of the people with disc protrusions are not experiencing low back pain at all, or their low back pain can be caused from some amount of disc protrusion and then also those non-discogenic sources. And those non-discogenic ones are much more within your control. Discogene is typically going to present as radiating pain. It is going to often also include the nerve because when the disc is protruding out, it creates pressure or irritation. Sometimes it directly pushes on the nerve itself. So any kind of bringing your leg up or slumping your back down or flexing at your chest is going to increase the nerve symptoms, but also the disc itself has pain fibers in it in that outer layer. So if you tear the outer layer of the disc and then create the protrusion from that tear, that alone has a lot of pain receptors and nociceptors which are going to fire up and cause back pain. That's discogenic. Non-discogenic is the muscles, the soft tissue, connective tissue. It's also the facet joints in your spine or the sacroiliac joints of your pelvis. Those are the non-disc related reasons why someone can have back pain, and those could be linked to being overweight, not being strong enough in your low back and core. It could also be ergonomic and postural because of just driving to work all day, sitting at a desk. However, the key takeaway is that the non-discogenic parts are parts that you can more immediately control and are environmental. Both types of these low back pains can coexist in the same moment. You can have disc-related pain and non-disc-related pain. And it's also true that while 32% of people may have a disc protrusion while simultaneously having low back pain, that doesn't mean that the disc protrusion is causing low back pain. There are many of us with protrusions walking around right now that don't have back pain and would never know that we had a protrusion until we experience back pain for the first time and then someone does an MRI. So let's debunk a few myths and misconceptions. One of my favorites, which we should all know by now is not true, is that bed rest is something that's good for you. It is well documented at this point that bed rest is the worst thing you can do for your back. The sooner you can begin to move and get back into your daily activities, the sooner you will be out of back pain. Now that doesn't mean you should ignore your pain, but that means that laying there on your couch or in your bed is not the path forward. As I like to say, doing nothing often doesn't do something. Get out of that bed. The other myth or misconception is that imaging is always necessary. What we say to our patients is that imaging by itself is just giving us a snapshot of what's going on in your back, and we're going to find things that may be helpful but may not be helpful at all. If you have low back pain and we do an MRI, for example, and you don't have a disc protrusion, that doesn't mean that you have no reason for low back pain. And also the opposite is true. As I said before, we may find that you have disc herniations or stenosis, but that actually doesn't mean that that's the reason for your back pain. And furthermore, most people don't need surgery, so I may as well lump that into these points of myths and misconceptions. Many of us with low back pain can get through it and be better on the other end of it without ever having gone through surgery. And most images change nothing about what you need to do. You need to get stronger, you need to improve your mobility, you need to make sure that you're making good choices in your life and with your lifestyle. If you do have an MRI, the one thing I will say is that it is a nice way to have some point of comparison in the future. So if your pain got so bad that someone ordered an MRI for you, and even though you had the MRI, it didn't really do anything to change the reality of what you needed to do to get better. You still needed to stretch, you still need to strengthen, you still need to be mobile. Down the line, if you get another MRI, maybe you'll see, oh, nothing's actually that much worse, or 20 years went by and it's only the tiniest little bit of more degeneration. The other misconception is that great amounts of pain mean great amounts of damage. We've seen patients at Mobility Doc who have the most complicated, most severe images we've ever seen from anyone in here, and they're walking around with a smile on their face. And simultaneously, we've had patients that have essentially nothing on an MRI but can barely stand. So severe pain doesn't necessarily mean severe damage. Now, that doesn't mean that their pain is simply not physical at all. That just means that there's a whole lot of non-discogenic components to their low back pain, and that it is complicated. Pain is complicated. It is not as simple as like you have damage or you don't have damage on, again, an image. And finally, before we get into genetics, I just want to say that lifting with a straight back is not something that you need to do for the rest of your life. Maybe in the absolute immediate circumstances when your back wants to spasm all the time, it could be helpful to try to keep a vertical spine or a straight back while you're bending down. But in the long run, you're actually just hurting yourself, because if you don't allow your body to move, and including to actually like bend and hinge and pivot and rotate through your spine, you're actually just perpetuating weakness and perpetuating tightness. The sooner you can begin to move in a more normal, natural way again, the quicker you will start your journey of getting out of your pain and never having it again. And now, before we get into the factors that are within your control, let's tackle genetics. There are some interesting studies out there that have shown there is some amount of correlation between having parents with low back pain and you having low back pain. They have studies with twins where they show that having a twin with low back pain means that you're 40% more likely to have low back pain. However, before you celebrate that fact way too much and decide that it's okay that you have low back pain, there's nothing you can do about it, what they've shown is that while there seems to be a genetic predisposition to having low back pain, your lifestyle and environmental factors are ultimately what are going to determine whether or not you have low back pain. So it's not as simple as your parent has bad back, therefore you must have bad back. If you have a good diet, if you don't smoke, if you're not too overweight, if you are strong enough and mobile enough and exercise regularly enough and move enough, you are very unlikely to have low back pain. And that's what I want to get into now. What can you do? What is within your control? Physical activity, folks. Physical activity is by far the number one thing that you can do to help your low back pain. In fact, maintaining an active lifestyle with a moderate level of intensity, meaning you're getting your heart rate up and you're challenging yourself on a regular basis, you can decrease the likelihood of low back pain by 40%. So you can like take half off of the likelihood of you having low back pain just by living an active lifestyle. And with living an active lifestyle means that you're less likely to be obese. While I understand that there's a lot of complexity and nuance to weight gain and obesity, it doesn't change the reality that obesity increases the likelihood of low back pain by almost 2 times. So you're almost 200% more likely to have low back pain if you are obese. Now, again, you don't have to be perfect. You just have to loop back into trying to live an active lifestyle. Workplace ergonomics play a large factor. A lot of us know this in this day and age, but making sure that your seat is right, your desk is right, your computer monitor is right, the mouse and the keyboard, that you take breaks, that you try to stand as much as you can, and then change it to sitting when you can. Changing up your ergonomics and not holding one posture for too long generally is something that all of us can control. Stress management is extremely difficult. It is a topic that can be like almost an infinite number of videos long, essentially, but there is a link between your level of stress and anxiety and the way that you perceive the intensity of your low back pain. So working with a healthcare professional on your stress, on your anxiety, prioritizing good sleep, good hygiene, those things again that are within your control. I understand that we can't always go to bed at the exact same time and always have 7 or 8 or 9 or whatever hours of sleep. That doesn't mean that you shouldn't try to as much as possible. Sleep quality is extremely important because the lower the quality of your sleep is, not only the increased incidence of low back pain, but also the higher your sensitivity is to pain in general. So trying to find the right mattress, the right consistency in hours of sleep, making sure that you're doing everything you can control to manipulate within sleep is the most important thing you could do. I personally like using a wearable. I know a lot of people are moving to the sleep aid mattress and things like that that help to monitor your sleep and control temperature. Feel free to help me out in comments below to share what's helped you to improve your sleep quality, as well as anything else that I mentioned so far about stress and ergonomics. Let's help each other, right? So the bottom line is that low back pain is not as simple as your age or your genetics. You cannot just blame your parents or the cruel reality of aging as the reason why you have low back pain, because there's a whole lot you can control. Living an active lifestyle, you can take 40% off right there the likelihood that you'll have low back pain. Improving the quality of your sleep, improving the ergonomics of your workstation, managing your daily stress, and also managing your body weight. These are all factors that are within your control, albeit at varying levels of difficulty, and you might need outside help to assist you through this, but you can do it. I promise you, you can do it, and doing nothing does not do something. Make sure you watch our videos on low back pain that we've linked in. If you want some extra help from us, we'll also include a link on how you can access a consultation with us or follow one of our MDRX programs for low back pain. Please don't hesitate, reach out with questions so that we can continue to help as many people as possible. Provide your comments to also help. Share, like, subscribe, help us to help more people. I'm Doc John from Mobility Doc. Thank you for watching.